Now to matters health, an anti-polio campaign has kicked off in Nairobi today, and the target is to further shield children under the age of 5 following reports of cases of paralysis associated with polio. Our reporter Caroline B is at the launch in Eastleigh and now joins us live with an update. Caroline, this particular process began on Monday from breakfast meetings and consultative meetings back to the people. How is the turn-up? How is this particular launch in Eastleigh?
Well, at least what actually began today was, it is the first process of the entire campaign. So what they were doing is trying to introduce it to the residents of Eastleigh. And where I am standing is that 200 meters from here is where the virus was discovered. And that's why they decided to come here and do the first campaign and also the first immunizations in this place. So what will happen is that they will be going house to house so that every child in that household below the age of 5 is going to get immunized. And it does not only happen in house to house. They also have other plans where on Sundays they will be pitching tent in churches. When it comes to the refugees who will be coming into the country, they will be screening and immunizing children under 5 and also those below 15 years who are coming into the country from other countries, more so the Dadaab refugee camp and also other camps across the country. But right now I'm joined by one of the lead officers who's in charge of this, just to give us information of what exactly are they expecting and how the program is going to be undertaken. So thank you very much, sir, for joining us. Maybe you can introduce yourself and tell us for how long should we expect this program to go on?
Thank you very much. My name is Dr. Thomas Ovaro. I'm the County Director for Health Services Nairobi. Since the time when we isolate the virus from the environmental sample, we have been working day and night to make sure that we achieve our objective, and the objective mainly is to immunize children under 5 years. We started trainings. We trained more than 1,000 teams who are composed of healthcare workers. And we are aiming to immunize more than 800 children within all sub-counties in Nairobi. We'll be going from house to house. We'll also be going to some of the schools. We'll be going to churches, mosques, etc., so that we can be able to access these children. And we are appealing for the parents to make sure that they avail the children to get the vaccine. The vaccine is very safe and it prevents the child from getting the polio virus. Yes.
So what kind of immunization are we expecting? Is it the injection or the drip? Maybe what details can you give us about the injection in itself?
Well, this current immunization is basically oral. In other words, we give 2 drops of the vaccine to the child, which is basically oral, which means it is even by mouth. There's no injections involved. Yes.
And the fact that the virus was discovered a few meters from here, what cautionary measures do you tell out to the residents of this place, and not only from here, but also for countrywide?
Well, the fact that sample was taken from about a few meters from here does not mean the virus originated from here, because basically it was an environmental sample, which means it must have been excreted to the environment, and that's why we found the virus, because we have a routine surveillance system. In other words, we take samples from various areas. We have about 3 areas, that's in Eastleigh, Kibera and Embakasi, where we normally take routine samples, basically to find out if there are any circulating virus. And
why the 3 places?
That is in Eastleigh, Kibera area and Embakasi area. Yeah.
That's why I'm asking, why exactly the 3 places? Why not any other place?
Well, this is basically a sample. We don't have to take everywhere. It can represent the whole of Nairobi. It's basically a sample. We don't have to take everywhere. Yeah. Yeah.
So thank you very much, sir. I've been speaking to Mr. Thomas Obari, who is in charge of medical services in the Nairobi County, giving us an overview and what we should be expecting in this immunization program, which has begun here today in Nairobi, but it will be spread across other counties in June and July, especially the high-risk counties. Some of them include Mandera, Wajir, Marsabit, Kiambu, Lamu, some of the high-risk counties where this immunization will be reaching. But not only the high-risk areas, they will also be spreading it countrywide. Remember, it is a virus that was discovered here in Kenya, similar to the one discovered in Somalia last November. Back to you, Akisa.
Caroline B. for us in Eastleigh. As the launch of the polio campaign begins today, I want us to wrap it up for our viewers on KTN Home, but we continue